Just watch the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. It's an invigorating show where Robin brings you experts in the field of health and health insurance. The audience can view the show and ask questions of her guests in real time. That's the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. What's in your health insurance plan?
Welcome to the Robin Harris Show, Health and Health Insurance. I am so excited to be here today with you, our audience, and we have such a special guest on the half hour, and you are just going to absolutely love what Cy Witherspoon from IMGlobal has to say. There has been so much happening in the field of health insurance since this whole COVID-19 thing. As you can imagine, so much has happened. There's been so many different updates, and that is one of the things that I am bringing to you, are those updates, are those helpful hints, are in giving you strategies and all these different things that will help you. Okay, because we really need to know how to navigate. There's a lot of great information out there, but a lot of it is not totally accurate. And that's the reason why we have this show. This show is to give you, the consumer, information from experts in the field of health and health insurance. Anyway, it's been a great week so far. Yeah. I went for a walk this morning, super early. As you can, I live in Phoenix, Arizona, so the weather was this morning crisp, even though we've already had 100 degrees. Now, I know if you're listening from Wisconsin, you're thinking 100 degrees. Well, in Arizona, that's on the higher warm, but it's not hot, as if it would be when we get into 115. It's like they say, it's a dry heat. And one of the things you might not know about me is that I'm always finding birds that are injured. As a matter of fact, yesterday morning in our garden, and I don't have the photo. I should have brought the photo, but my husband said there's a bird in the garden. And sure enough, I look under the leaves. He was on the ground, and there he was, the baby bird. And he's just standing there, just. I saw another bird in the bushes, and he was doing the same thing. And I gather what happens is that the mom leaves them there and then comes back, because in both instances they were gone. So I gather the mother came and got them. But you know, one of the things, how I got into injured bird is I found an injured bird, and I didn't know what to do. And I'm like, what do I do with this injured bird? I scooped him up, and I frantically was looking for a place to bring them, maybe a vet, but vets, from what I'm seeing, don't take them, but they do have bird sanctuaries. And in the Phoenix metro area, you have Liberty Wildlife and you have Fallen Feathers, so there are places to bring birds. I've already rescued 4 birds. So wherever you live, take a look and find a place where you can bring an injured bird, because we love our birds. They give us music in the morning and all that, okay? So it's been a great week, and what's happening now is statistics are coming to the fore. Statistics on job loss, how many COVID-19 tests, people have taken the test, how many people have died, how many people have gotten the disease. And if you go to my website, robinharrisadvisors.com, Robin Harris Advisors, SORS.com, I post on, you go to News tab, I post the latest COVID-19 statistics, and I'm due to update it tomorrow. But you will see the latest statistics. Now, I'm not going to go into that today because I've done it 2 weeks in a row, and you could just go there and take a look. But what I am going to talk about today is eligibility for Affordable Care Act health coverage following job loss. And these statistics just came out yesterday, and I tell you, they were sobering to me. So I'm going to go through this. And I'm just going to read this to you. It's saying that the economic consequences of the coronavirus pandemic have led to historic level of job loss in the United States. Social distancing policies required to address the crisis have led many businesses to cut hours, cease operations, or close altogether. Listen to this. Between March 1st and May 2nd, that's just 2 months of 2020, more than 31 million people had filed for unemployment insurance. So we can only imagine the implications of that. Now, my main client is the small business. That is my demographic. That is the main, I serve others, of course, but my main demographic is the small business owner, and they are hit hard. So, it goes on. Actual loss of jobs and income are likely even higher, as some people may be only marginally employed or may not have filed for benefits. Some of these unemployed workers may go back to work as social distancing curbs are relaxed. Though further job loss is also possible if the economic downturn continues or deepens. In addition to loss of income, job loss carries the risk of loss of health insurance for people who are receiving health coverage as a benefit through their employer. People who lose employer-sponsored insurance also can elect to continue it for a period by paying the full premium called COBRA, which is continuation of coverage, or may become eligible for Medicaid or subsidized coverage through the Affordable Care Act marketplaces. Over time, as unemployment benefits end, some may fall into the coverage gap that exists in states that have not expanded Medicaid under the ACA. What are coverage options for people losing employer-sponsored coverage? Okay, so now what is all this saying? So now a person could go utilize their COBRA benefit if they had a group plan. They could go with COBRA, which is their continuation of coverage. And I'm going to get into that a little bit because COBRA costs money. And you also might qualify for Medicaid. But what I'm going to show you is that Medicaid is not the same in every state. And there are some implications there. So eligibility for health coverage for people who lose employee-sponsored insurance depends on many factors, including income while working and family income while unemployed, state of residence, and family status. So there's different factors that affect your eligibility or how much you're going to pay. Some employers may temporarily continue coverage after job loss, but such extensions of coverage are typically limited to a short period. Now, I want to talk about that because when this whole thing started, I was on the major carrier conference calls. Now, when I say carrier, that word means your health insurance. So if you're on, I'm just going to say names, okay? I usually don't like to say names, but I have to in this instance. So you're at your group and they have, Blue Cross Blue Shield, Aetna, United Healthcare, Humana. If I'm missing anybody, please don't be offended. But if you are on their plan, what happened is the group carriers came out, they had conference calls with the brokers, and they told us that, depending on the carrier though, not all of them were doing this, you can, if you're an employer, you can have your furloughed worker or your worker that is only getting part-time hours, let's say you had to lower the hours, they can now have a special enrollment period. And I've talked about special enrollment periods, but these things take time to digest and understand. So what they were doing is they were saying, for that employee, that during open enrollment or when they became new with that job, they did not want that health insurance. They didn't want that money coming out of their check. They're not, and they waived coverage. Now they're saying you can now jump on that plan. And if in the contract, you now have it states that your family can be covered, now even they could get on that plan. So some of the carriers were doing that, but that was only for a short period. Now it says here, regarding Medicaid, some people who lose their jobs and health coverage, especially those who live in states that expanded Medicaid under the ACA, Affordable Care Act, may become newly eligible for Medicaid if their income falls below state eligibility limits. Now, in our state of Arizona, that's 138% of the poverty in states that expanded under the Affordable Care Act. So what happened during the Affordable Care Act, when that was signed in 2010, and it was rolled out for the new year of 2014, many states had adopted a more robust Medicaid. It's called a Medicaid expansion. And so what you're seeing is that many more people are able to apply and get covered on Medicaid. So what you do, if you want to find out if your state has a more robust plan or if you qualify, you want to go to your state, put in your state, Medicaid, and it will come up. So in the state of Arizona, you put in Arizona, Medicaid, and that brings up what's called access in the state of Arizona. Okay? Let me just see. There you can also calculate your income. So people have questions. Now, I am not a Medicaid specialist. So if you want information on that, you want to go to them directly because each state is different. And people have questions like, well, do they count just my income? Do they count what's in my bank account? What about do they count the income of if my sister is living with me, you know, all this kind of stuff. So there you want to go directly to your state and get that information. So, and that is that. And then here, Affordable Care Act marketplace coverage is available to legal residents who are not eligible for Medicaid and do not have affordable job coverage. Subsidies for marketplace coverage are available depending on income. So now you lose your job coverage and you could go on COBRA, but what if your COBRA for your family is $1,700? That's the average. $1,715 is the average family COBRA. That is the statistic. Now, I didn't get that out of my hat. I got that right off of Kaiser Family Foundation. And one thing that they do is they're all about statistical data, and they know the numbers. So say, for instance, you can't afford that, and your income has dropped, of course, you lost your job, but you don't make low enough for Medicaid, and you have family members that need a major medical policy. So what do you do now? That's where you go on the marketplace. And it says, while current income is used for Medicaid eligibility, that's your current. So when you apply for Medicaid, they're looking at your current income. That's why every 6 months they make you submit income again, because they're looking at current income. But how marketplace is different. They look at your projected year. So you're saying so when you're filling out the application and you have to put in your income to see if you get a subsidy, you're looking at what you are going to claim on your 2020 tax return. You say, well, I don't know what my income's going to be. You just have to do the best you can. And if you're self-employed, you say, well, I'm self-employed, I don't know how much. So you basically talk to your accountant, talk to your bookkeeper, and figure out what your adjusted gross income is going to be. You know what I'll do for you? I am going to post on, I'll get that posted for you today, how to access on healthcare.gov, how to get that, figure out what your income is. Okay, so I'll get that posted. So you will go to robinharrisadvisors.com news, and that will be in there for you. Okay, I'll get that done. So, all right, advanced subsidies are available based on estimated annual income. Okay, thank you. Advanced subsidies are available based on estimated annual income, but the subsidies are reconciled based on actual income on the tax return. So what does that mean? It means that if you have a marketplace coverage and you estimated your income for the year 2020 and you found that your income was more, then unfortunately, you're going to have to pay that back. So it's based on, the way marketplace insurance is based, it's on your tax household. So if Mr. and Mrs. Smith is in that household and little Johnny and Mary are in that household, and then there's also maybe adopted child, or maybe taking care of a niece, and that niece is on your tax return, all those people on the tax return are on that income. All right. And so if they find out that, if you find out over the course of the year that you made less money, that's reported to healthcare.gov, marketplace, or the state, wherever, state exchange, and then you get a refund. So you really got to take a look at that number. All right. People who lose jobs may be eligible for employer-sponsored insurance as a dependent on parents' job-based coverage, and they must be 26 or under. So let's say one of your children is away at school or had a job and they lost their job, and now they had to move back home, as an example, and they're under 26, they could be on that marketplace coverage. Many people who lose their job-based insurance can continue that coverage through COBRA, although it is typically quite expensive since unemployed workers generally have to pay the entire premium. Employer premiums average. Now, this is interesting. This is a nationwide statistic. The average COBRA payment for an individual is $599 a month. And the single, like I mentioned before, is in the $1,700 range, and plus a 2%, additional 2%. And that's just the medical. Now, we're not talking about dental and vision, which also could be extended through COBRA. People who are eligible for subsidized coverage through Medicaid or the marketplaces are likely to opt for that coverage over COBRA through to COBRA, though COBRA may be the only option available to some. If you are ill, COBRA might be the better choice because of network. And I really added that because when I get a call and somebody says, I'm looking to retire, I've lost my job, I'm making a transition, I'm starting my own business, so I want to have a consultation on what to do next about my health insurance. If that person has serious sicknesses, like maybe cancer, COBRA could be the better option, even though you're paying more, but it's more likely a PPO network and all your doctors are in that plan. So you really need to look at all of those details. If you can afford it, usually COBRA, if you could afford it, COBRA would be the better option in most cases. Now, they also talked about in this article, and now this article you can see on my website, robinharrisadvisors.com. Go to news, the news link, and you will see the link to this. This article is posted with the graph. Can you put that graph up, please? Thank you, Scott Guru. All right. So I can't get over this slide. I just can't get over this slide because it's amazing to me. Between March 1st, 2020 and May 2nd, 2020, before March 1st, there were 78 million people lived in a family where somebody, let's see, let me say this again. Between March 1st, 2020 and May 2nd, 2020, we estimate that nearly 78 million people lived in a family which someone lost a job. 78 million. 78 million people lived in a family where somebody lost a job. Most people in these families, 47.5 million, were covered by an employer-sponsored insurance prior to their job loss. Nearly 1 in 5, 17% had Medicaid, and close to 1 in 10, 9% were uninsured. The remaining share either had direct purchase marketplace coverage, 7%, or had other coverage, or Medicare, or military coverage. Now, when we look at this graph, out of the 47.5 million that had employer health insurance, now, if you look at the top green on the right, only 19.2 million have lost job coverage. Well, it's time for a station break. We'll be right back.
When you want to get the accurate information about the future of health and health insurance, just watch the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. It's an invigorating show where Robin brings you experts in the field of health and health insurance. The audience can view the show and ask questions of her guests in real time. That's the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. What's in your health insurance plan?
Studio8181.com is a talent development and management company that owns its recording studio and video production center located in Peoria, Arizona. Share your media content, earn income, and talk to your fans all from one spot. Studio8181.com positions your content to be seen by important decision makers so you can attend exclusive auditions and or get invited to perform at venues many entertainers only dream about. The producers and engineers are determined to create new opportunities for talents, aspirants, and future stars. Don't have the money to do a soundtrack or a promotional demo video? Not a problem. You can simply request and schedule an audition. If you have the talent, we want to hear from you. Get your entertainment website and more. Email us at info@studio8181.com. Thank you.
Welcome back to the Robin Harris Show, Health and Health Insurance. Can you bring that slide back up, please, Scott Guru? Thank you. I was talking about this slide that now there were 47.5 million people in the United States had employer health insurance, and now only 19.2 million have job coverage. This is mind blowing. I've never seen anything like this. You know, I have never been on the front lines of anything. This is the front lines. Me giving this information to you, I haven't heard this in the regular news. But you are hearing this right here on the Robin Harris Health and Health Insurance Show. And what else is very interesting about this? Now, it says there on the slide on the right, newly uninsured due to employer-sponsored insurance losses, 26.8. 26.8 million people have lost their group health insurance. So that's the person, but what about the families? under that umbrella? What about the brokers? What about the health insurance companies? What about all of these ramifications? All these people now that are without coverage don't know where to go. So that's why having a good broker is so important, because what happens is people go to a call center and a lot of times they're sold something that's not good for them. And then they get spammed with phone calls. That's not the way it should be, right? So the other thing that this article brought out, and you go to my website, robinharrisadvisors.com, go to the news tab, and you'll see this article posted. It goes on about January 2021 projections after unemployment insurance runs out. Eligible people may not know about coverage options and may not seek coverage. Others may apply for coverage but face challenges in navigating the application and enrollment process. Still, others may find marketplace coverage in particular unaffordable, even with subsidies. So already the projections are looking into January 2021, and they're already showing that they are not looking good. All right, because they're saying that we haven't even seen all the job loss. So there are options for you, and you can call my office 602-663-2810 to get a free consultation to find out what your options are, so you can get sound advice to help you to navigate this thing. All right. Now, I am so excited because we are having a special guest, and that is Cy Witherspoon of IMGlobal. I am really excited about this because I've been working with Cy, I think it's about 4 years now, and he is my mentor. He is my mentor in the global medical and travel medical insurance. I'm very passionate about travel medical. I'm very passionate about global medical, and the reason why is because your health insurance, I always looking for resources for my clients. And if you are traveling abroad, your health insurance doesn't cover you. They can hold your passport, anything can happen to you. So Cy is going to be here with us to talk about this most important and vital coverage. So before we do that though, Scott Tech Guru, can you please play the first video?
Ladies and gentlemen, boys and girls, and IMG employees of all ages, prepare to witness the resource tool, the spectrum known as the Big Top. So first thing we're going to do, ladies and gentlemen, is go to www.imglobal.com/ Just kidding. I bet you thought I was going to talk like that the whole.
Oh wow, Cy! We are fortunate to have a special surprise guest from he's a representative from the travel insurance industry. Cy Witherspoon the third is the training and digital support specialist at IMGlobal. Cy's career path has transcended disciplines and even international borders. During his journey, he has worn multiple hats on numerous occasions, while simultaneously accomplishing lofty goals in the area of marketing research, analysis, qualitative lead generation, digital content, consultative training, business development, and he's also a public speaker. Cy represents IMGlobal, a leader in the travel medical industry with more than 25 insurance plans, 43,000 producers, 800,000 doctors and hospitals in its global database around the world, and millions of members worldwide. IMGlobal continues to redefine the industry it has defined since 1990. Cy Witherspoon, here you are, right here. Woo! How you doing?
I'm fine. How are you doing today, Robin?
Excellent. I surprised you, didn't I?
You did, especially with the big video.
I mean,
that was.
I love it. I love it. Cy, you've been helping me a long time. You've been my mentor in.
Appreciate that. Thank you.
Yes, you have, in global medical and travel medical. It's a plan that I'm very passionate about because, people travel, and I would say, what do you think? About 90% don't even know that this coverage is available to them?
Yes. The last stats that I saw, it's somewhere around 85% of people travel outside of this country. And this just, again, the outbound travelers, people leaving the country, 85% of them have no type of international coverage.
Yeah, I can't imagine that. I never leave the country without it. Ever.
No, it's important. It's important. Well, you're going to find that for the most part, a lot of people either assume their domestic health care plan will cover them, or they just don't realize that this type of coverage exists. But the thing that most people need to realize is that most domestic health care plans may not even cover you. And again, it varies from state to state, region to region. I know Arizona, you have different laws, but for the most part, this is going to be true, being that most health insurance plans may not even cover you outside of your own county, let alone your own home state. So as far as covering you internationally goes, there's going to be very little, if any, coverage at all. As you mentioned about Medicare essentially stops at the border. And right. I don't mean the border of the state of Arizona, I mean the border of the country, unless the client has a supplement plan. But even supplement plans only cover up to $50,000 lifetime max for emergency medical, and that is going to be on a reimbursement.
On a reimbursement, so you better have the 50,000.
Mm-hmm.
I mean, the average person, maybe they have 10,000 on their credit card, but if they are overseas and they're in the hospital, granted that health insurance costs are nothing as extraordinary as the United States, but at the same time, it's still a cost. You're going abroad to have fun.
Mm-hmm. Yeah, well, it's not like you're planning a trip to, like, say, Paris, for example, and you say to yourself, you're planning your trip and you're saying, oh yeah, I want to go to see the Eiffel Tower, and then I want to go see the Louvre and see the Mona Lisa, and then I'm going to eat in a nice French cafe and have some croissants, and then I'm going to go step out in traffic and get hit by a car. You don't plan your trip that way. You don't plan your vacation that way. But sadly, things fortunately do occur.
That's right. And what I say is suitcase, passport, travel medical.
Exactly.
Right.
Well said. Good model to live by, especially when traveling abroad. Absolutely. Or travel in general. Mm-hmm.
So, what is the difference between travel medical and travel insurance, Si?
Great question and a great segue. So as far as travel medical, there's two basic types of insurance. So travel medical insurance, and then of course you have travel insurance. So travel insurance, if you've ever purchased an airline ticket, if you've ever purchased or booked passage on a cruise line, that type of insurance, they'll usually have like a little pop-up at the end after you pick your dates and times.
Right.
It'll say, hey, for $49.95 more, you can cancel your trip and or change your dates or get a full refund back on your policy. So that's known as a travel insurance or trip protection plan. Travel insurance essentially is probably the closest thing to that, being that it's designed to protect the health. It's designed to protect the investment of the trip. So when it comes to like with this whole pandemic, a lot of people canceled their trips. All the carriers, for the most part, have been very understanding, even if the client had no non-refundable ticket. But we found that with this kind of coverage, it would actually essentially make you whole again about the investment. Now, our travel insurance plans actually go a step further because they actually have some medical benefits rolled into it. But travel medical insurance is more specifically designed to cover the client's health and well-being. Some of the main selling points that I always pitch and we've talked about many times are like emergency medical evacuation, a life flight, air ambulance. Average cost of an air ambulance is anywhere between $25,000 and $60,000 for a regional evac. So as far as for an international evacuation, the cost can be prohibitively more expensive. And you talked about maxing out credit cards. It's probably, in a lot of cases, people might have to refinance something.
That's right.
Big borrow or steal just to get that together. So, but yeah, that's pretty much the main difference between travel insurance. Travel insurance is really designed to protect the investment of the trip. Travel medical insurance is designed to protect the health and well-being.
And people think it's so expensive, but it's not.
It's extremely affordable.
I mean, from my husband and I to go to Europe for, I don't know, just a week or just over a week, as an example, it could be $50, $60. I mean, it's not that much.
Yeah.
I mean, it's worth it. And, but it does, the travel medical, the vacation holiday plan that IMGlobal has does have some trip protection with that too, right?
So the travel medical insurance side of the plans, so like the Patriot series of plans, Patriot Travel, Patriot Platinum, Multi-Trip, Globe Hopper Senior, those plans do have some coverage for trip interruption, being that if you needed to interrupt your trip, it's usually for a pretty extreme scenario, being destruction of your primary residence, burglary or fire of your primary residence, or death of an immediate family.
Okay.
You can interrupt the trip. But with the travel insurance plans, not only can you interrupt the trip, you can also cancel. And in some cases, we will allow, depending on the plan type, we have a cancel for any reason benefit under our iTravel Insured LX plan, which, again, you have prominently exhibited on your website, that the client can cancel for any reason.
Right. And Cy did mention that I have the global medical tab. On my website, robinharrisadvisors.com, I have a global medical tab. And when you go into that, you will see all the different type of travel medical, global medical, expatriate, and so on. I have those insurances. And I have it prominent on there because I'm such a believer in this product. So, Cy, real quick, what we're going to do, let me ask you this. Does credit card insurance cover a person sufficiently? Because I know credit cards always advertise this type of thing.
Yes. Well, I will tell you, I'll actually answer that question by telling you a brief story. I had a producer that I trained about maybe 14 months ago, because again, that's one of my responsibilities with IMG is to train agents and eventually make them dangerous. But like you. But she told me a story of her last trip with her husband and some friends of theirs. And so basically, she was the agent, and she purchased one of the Patriot plans for her and her husband because they were going somewhere in the Bahamas. Now, again, this was 14 months ago, so it was before those hurricanes, or before the last hurricane especially. But they were on the trip. They were having a good time. She did offer the plan to the friends that were traveling with her, and I don't know if it was because it was their friend that was offering to sell them insurance or what, but from what she told me, she said that they had some kind of travel insurance or trip protection plan on their credit card or with their credit card company. I don't know which one. In all honesty, I didn't even ask. But anyways, they're on their trip. They're having a good time. All of a sudden, the companion's husband has a massive heart attack. Now, again, from what she described, the resort that they were at was very remote. In other words, it was far away from everything. And they did have a doctor that was on call, but let's just say that the doctor on call wasn't equipped to deal with a heart attack. So they had to request a life flight or air ambulance, or as IMG calls it, emergency medical evacuation,
Right.
to medically evacuate him to the closest qualified medical facility, which is in Nassau, Bahamas. Now they did get him there in time, and fortunately that gentleman did make a full recovery. However, unfortunately for them, their credit card company's trip protection plan did not cover for emergency medical evacuation. And their domestic health care plan that they had back home in the States didn't cover for international emergency medical evacuation. And so that couple basically had to spend out of pocket over $40,000. So you're talking about maxing out credit cards,
and then
pretty scary scenario, especially, what if you don't have that, readily available.
Yeah, I mean, you're going to have a good time. You're not thinking about that. That's why you get this protection, because that way you don't have to think about it.
Mm-hmm.
It's
like that with any insurance. I mean, we as insurance providers and insurance brokers like yourself, you don't want your clients to ever have to really use the insurance. You really want them just to have it just in case. But if that just in case happens, you want them to be prepared.
That's right.
And bottom line, that's all that these plans do, is they prepare you for the what if and the just in case.
That's right. I want to know, Cy, you're based out of, IMGlobal's based out of what city?
We're based we have actually 3 offices globally, 3 physical locations globally. As you could probably tell, I'm at home right now, but most of our corporate office is based in Indianapolis, Indiana. That's where corporate headquarters are. And then we also have 2 physical locations in the United Kingdom. One of those locations actually handles all of our emergency medical evacuations. And that's really an awesome team to see in action.
I would love to see that.
Yeah, it's we've seen videos, and it's amazing just watching them work. I mean, we've been in business almost 30 years, and just between, I think it was 2015 and 2018, we averaged 1 emergency medical evacuation every 9.13 days. So it's, unfortunately, they're good at it. And I say it unfortunately because if they're working, then that means someone's hurt or something's wrong.
That's
right. That's why I say unfortunately.
And we're going to talk about that, like the whole emergency thing, and how you have people on staff that have different languages, that that speak different languages. But one of the things, and I did a video of this on Facebook, was the level 4. I checked it last night, Cy. The level 4 alert on travel.state.gov. Oh my, I didn't realize it was still in place, because I had a trip I was supposed to go to. It's a good thing I didn't get my travel medical yet, because then but can you talk about that? I mean, like, you've had to bring people home, right?
Well, yeah, with everything with this entire pandemic, I mean, this is really an unprecedented type of situation. I mean, this is the first time really in 100 years that we've had an actual global pandemic where, people are dying. Lots of people are dying. I mean, the last count I saw just domestically here in the U.S., we were something around 81,000 deaths so far. And that's just only been in a couple of months. So with that being said, IMG, as of March 22nd, which is when the U.S. State Department issued a level 3 global advisory about the pandemic, as of that point, it pretty much sort of washed away the benefit or any kind of coverage for COVID-19 if you were to have purchased the policy then. Okay. Now it's obviously been increased to a level 4, which is the most extreme warning. I mean, in my almost 8 years of being with IMG, I've never seen U.S. State Department's website look this way. All of these red, identifiers. But yeah, it's pretty scary.
Yeah, I mean, because you only see that when, don't go to Afghanistan type of thing. Don't go to North Korea.
Right.
And now it's like,
Right.
Don't go to France.
Right. Don't go anywhere, actually.
Yeah. So, Cy, real quick, we're going to take a station break, and then I'm going to do a video, IMGlobal video. All right?
Okay. Hopefully not the big topic. Right?
We'll be right back.
Welcome to Ocotillo Dental Care and the office of Dr. Jeffrey S. Gorelick. Ocotillo Dental Care is conveniently located in Chandler on the southeast corner of Alma School and Queen Creek Roads in the Albertson Shopping Center. Take your time, browse our site, and see why you should make Ocotillo Dental Care your premier choice for all your dental needs. And now a word from Dr. Jeffrey S. Gorelick.
Thank you for coming to our website and learning more about Ocotillo Dental Care. I'm Dr. Gorelick, and welcome to our office and learning more about us. People call me Dr. G. We are
a pillar in the Chandler community for over 10 years.
When you want to get the accurate information about the future of health and health insurance, just watch the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. It's an invigorating show where Robin brings you experts in the field of health and health insurance. The audience can view the show and ask questions of her guests in real time. That's the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. What's in your health insurance plan?
You're live. Welcome back to the Robin Harris Show, Health and Health Insurance. And with me is my special guest, Cy Witherspoon with IMGlobal. Cy, I'm going to do a quick video, a testimonial on the power of travel medical. Can you roll that, Scott Guru?
Hi, my name is Mark Kogelman. In August 2014, I planned a trip to South America with my friends. So the very first day we went skiing, I was riding up the chairlift with my friends. We were having a great time. We were skiing groomer on the way down, and unfortunately there was an unexposed rock right there. So I skied over this rock. It stopped me dead in my tracks. I did a somersault, and I cracked my skull open, forehead to crown. At the same time, I fractured my cervical 1 spine in 4 separate places. So essentially I broke my neck and ultimately damaged an artery to my brain. Not only was I scared that, my life was in danger, but also the ramifications of the money that it would cost to have a surgery down there and get life flighted out. What the impact would be on my family and myself. I spent 12 days in the hospital there. What normally would have cost hundreds of thousands of dollars cost me a $500 deductible and I think $130 out of pocket.
Normally when you call a company like an insurance company or a credit card company or anything like that, you kind of expect there to be a long wait time, to be on hold. And I was already really stressed out about everything that I was having to take care of. So I was like, oh, this is just going to be awful. And they picked up right away, and I spoke with Rob. I just remember pretty much immediately he said, yeah, this is going to be covered, don't worry about it. And that just took so much stress out of me. He coordinated the trip from both ends. He coordinated the healthcare from both ends. Everything was taken care of. So all I have to take care of was just getting myself down to Santiago to take care of Mark. I mean, it just took this whole burden off of me.
I took comfort in the fact that IMG had my back. They really orchestrated everything. They took care of all the arrangements I had, from the airlift to Santiago to paying my bills in the hospital. If you're thinking about travel insurance at all, definitely get it. It saved my life and it could save yours. I'm back now, fully healthy, skiing, hanging out with my family. Without IMG, I wouldn't have been here.
Cy, that is such a compelling testimonial for travel medical. Can you give us a little background on this?
Yes. So that was the Mark Kogelman story. And basically a little background on Mark Kogelman. He is an adventure skier, and he's also a filmmaker, which is why they happen to have equipment out there with him. Now, from what I understood about Mark's background, the trail that they were on, or the course that they were on, was not a real high risk type of course. But what had occurred was, while he was skiing, he elected not to wear a helmet.
Oh.
And while he was skiing, his ski actually got stuck right on an exposed rock that must have melted away. Because if you notice the weather in the video, it was like open sky, sunny. So
right.
I'm assuming that the snow had melted away and then that rock was exposed. But as soon as he got stuck, I mean, that's when he flipped and basically cracked his head and hurt his spine very, very badly. But that's why they ended up filming. Mm-hmm. And initially, Mr. Kogelman had written about it in a blog, and one of our creative guys actually found it and then reached out to him and had asked him, would he be willing to actually do a client testimonial with us? And he said, actually, I have a lot of the footage that you need already, because I actually filmed the whole thing. So they worked together with our creative guys. One of our creative guys, Mr. Wilson Mack, he's amazing, by the way. And I'll have to send you some of his work. They put it together, and that's how it came out. But it was very important though. When he purchased his short-term travel medical insurance policy, he actually had what is referred to as an adventure sports rider. Mm-hmm. Now, the adventure sports rider is an optional add-on rider.
Right.
When you look at it, you would think that it would be just extreme sports from the way that the description is listed. However, really, it will cover you for basic things. So I always recommend, if the client is even remotely active, if you are a hiker, if you plan on just walking a regular trail, if you plan on walking on the beach, if you plan on doing snorkeling, okay, on your trip, just get the adventure sports rider. The cost difference is really, really minimal.
It's minimal. I know.
Compared to what could have happened had you not had the adventure sports rider.
So does that also cover because a lot of policies, they do not cover if you get paid for that sport?
Yes. So we will cover for amateur athletics. We will cover for any kind of, with the travel medical insurance policies, we'll cover for any kind of remotely active activity that you're involved in. Now, we do have some student policies, which you do have exhibited on your website underneath Global Medical, and then where it says Student Scholar. Those plans actually have add-on riders, and in those policies, we actually will cover for amateur athletics, as long as, like with the Patriot Exchange program, it's up to high school age, and with the Student Health Advantage Platinum, as long as it's up to collegiate level age sports.
Okay, excellent. Mm-hmm. Because a lot of policies, they don't cover those. Now, you were an expatriate, right? Expat, is that how to say it?
An expat or expatriate, yeah. The official word is expatriate, but I was an expat at one time, and not to sound kind of corny, but at one time I was actually a client of IMG's long before I started working here. But yeah, I did live in Mexico for a grand total of 3 years, and as an expat living in Mexico, number one, it's extremely humbling, to say the least. Makes you really appreciate the kind of life that we can have here in the States in comparison. Initially, I did work from home for a company based in the States, and that was awesome, because making stateside money in Mexico was amazing.
I can imagine.
We could stretch it really, really well. fun.
Not a bad
But
idea.
then, oh yeah, when that job ended, I had to do basically local type of work for expats. Now, down there, they're a lot more forgiving than they are here as far as like work requirements. Even though I was Mexican, I'm married to a Mexican national. I had to go get my work visa, but it was extremely a simple process. But unfortunately, with my background, and I thank you for sharing that with folks about my background, even with my background, I could only get really two kinds of jobs. And it was either telemarketing or timeshare. That was it. Those were my only
Really?
choices.
Why is that?
Because my Spanish wasn't that as strong as it is now. Yeah. But living down there definitely forces you to speak Spanish. So, all right. But so anyways, while I was living down there, as I said, I was there for 3 years. So every once in a while, I would get homesick. Granted, I love the food down there. Don't get me wrong. Like going to the local taco stands and getting like tacos al pastor and pescado tacos and these tortas, which are like sandwiches called ticos.
It's almost lunchtime.
Oh my God. No, it was amazing. It was amazing. But every once in a while I would get homesick. I wanted to have a burger, and this particular day I wanted to have a burger, and we went to Burger King because they have Burger King there. Why I didn't go to McDonald's, I don't know, but I went to Burger King. And I ordered, I was eating a lot then. So it was like 2 double-double. No, I'm sorry, I'm saying double-double. That's In and Out. Oh, what I'd get for one of those. They don't have them here. But anyways, I ordered like 2 Whoppers or something like that. And then I ate them both and I was fine. And so you have to understand, where I lived in Mexico, it was Cancun, to be honest. It was very humid. Okay, it's a humid place. And I just felt kind of itchy on the back of my neck, and I just assumed I was getting bit by a mosquito or something. So I just let it ride, and I was like, okay, I need to just take a shower. So while I was taking a shower, and then I noticed like these bumps started popping up all over my back.
Really?
And then all over my face, and then, my face started to contort. My lip, I have, larger lips, and like, imagine my lip like double the size. Like it was really scary when I moved the steam off the mirror and I saw myself, and it was worse than Hitch. And I was just like, oh, it was really bad. So my mother-in-law was there, and at the time, her English is still, I love her to death, by the way, don't get me wrong. But her English was really not as strong, and my Spanish at the time really wasn't as strong. And so I just basically told her I need an ambulance, and I was like, look, Senora, look at this, there's something wrong. And they ended up calling the ambulance. Ambulance came. They took me to the hospital where they normally send tourists, because they saw, oh, he's an American. They assumed I was a tourist, but I was an expat. And so that hospital was Hospital Americano. And I ended up getting there, and they ended up taking care of me. But sorry for the long story, but
what happened? What was it? It was just a hive reaction to the burger?
It's an allergic reaction to something that I ate. It's a preservative that I picked up down there. And pretty much ever since I've lived down there, I tend to get that when I eat certain things. I've done the whole food allergy thing, and I've been examined and tested, and they still don't know what it is. So now I just have to be paranoid about what I eat, but I'm really not. I just carry my EpiPens and
good to go.
If it happens, I just shoot myself. That's it, because I like to eat. I like to enjoy good food.
Absolutely.
That's just my thing. But, yeah.
So you were expat, and you had this IMGlobal. Now, did you had the expatriate plan?
I had on your website where it says global medical insurance, under where it says expat global citizen. It's the policy that you have featured there called the global medical insurance plan. And actually on your site, there's a video there. You might recognize some people in that video, but it just talks about being an expatriate, and surprisingly, a lot of my colleagues, we've all lived abroad. So it just makes us, I think, even more understanding about the need for this kind of insurance.
It does.
When it happened, though, going back to what had occurred, so when I was at the hospital, my mother-in-law had my passport, and they actually took my passport from my mother-in-law, and they basically said, "You need to pay this bill in full."
Okay,
Otherwise,
stop right there. Stop right there.
Go ahead.
I tell people this. They will take your passport.
Yeah. Oh, yeah. Well, I mean, it's like this. It's like that anywhere. I mean, you and I, we're residents. We're citizens of this country, right? We have to follow the rules and laws of the land. Same for people that come and visit this country or migrate here. They're, responsible, and they have to follow the rules and laws of the land. It's the law. It's just the way it is. But what most, and I hate to say this, I really hate to sound stereotypical, but most Americans don't get that when they go abroad. They assume that, oh, I'm American, it's fine, I can do whatever I want, I'm American, I get away. No, it's not like that. When you're in someone else's sovereign country, you are just as responsible for their laws and rules as you would be if you were back home. You have to be cognizant and aware of the laws and rules of the land. So when you're in someone else's foreign country, when you're in another country, same thing. You have to be respectful of what their laws are. And they literally can take your passports.
Yes.
They will take your passport.
They will take your passport.
And they will take your passport. Some places will actually take your passport until that bill is paid in full.
And there's countries you cannot go there without the travel medical. Am I right?
Correct. So a perfect example of that are Schengen countries.
Mm-hmm.
Schengen countries, most of them are in Europe. It's mainly the European nations. Think of the geography of the European nations. They're all pretty much landlocked, bordered right one on top of the other. Okay. Most of those countries, actually most countries in the world, have nationalized healthcare.
Yeah.
Okay. In their countries, so like you look at like Spain and France, I'll give you those examples. Let's say you have a client or someone from Spain, and they go to France. Something happens while they're in France. Well, that Spanish national in France, his insurance or their insurance will be recognized the same as if they were in Spain. And that's the agreement that all of those European countries have. It's called the Schengen Agreement. Now, for going to those countries, you also have to have proof of travel insurance. And you have to provide that proof in some cases before even a visa is issued. I don't know how strict it is. But in this country, prior to this whole pandemic, you may have heard about that this administration actually issued something similar, where if you're coming to this country, you have to have proof of insurance. That was one of the latest presidential proclamations prior to this whole pandemic thing going on. So it's just the way it is. And it's just for the cost of what the travel medical insurance policy is, or even what a travel insurance policy is, it's just well worth it in comparison to what it could be if you had that $40,000 emergency medical evacuation and that $50,000 doctor's bill.
I can't imagine.
So,
I can't imagine you go on a beautiful vacation and now you have a $50,000 bill.
Right. In another country.
And
then they took your passport because you didn't pay the bill.
Oh my God. So what about if I'm traveling to multiple locations?
Great question. Okay, so our travel medical insurance policies essentially will cover you anywhere outside of your country of residence. So for example, we can use Europe again. A lot of people, when they go to Europe, they may start off in one European country, but they may decide to go ahead and just venture around and then take off again. I had a client call, actually. This gentleman, him and his wife, they were celebrating their 60th wedding anniversary, I believe. And their lifelong dream was to go to Europe and tour around. So they did one of those riverboat cruises, and then they rented a car, and then they drove around to like 4 or 5 other countries within the European Union. And so, bottom line, with our policies, you'll be covered as long as you're outside of your country of residence.
Right. When I quote the first destination.
I was going to say that. Yeah, that's what you want to see.
And then even if they're going all over Excellent. Does a person get their money back if they cancel their trip for the premium?
Great question. So if a client were to cancel a travel medical insurance policy, they will actually get, if they've canceled the policy prior to their effective date, the client will receive a full refund. If the client cancels during the policy while it's in effect, they'll get the unused portion back less a $50 cancellation fee. Now, unfortunately, if there are any claims on the policy, then there's no refunds.
Right. That makes sense. So, and then let's see. Can we talk a little bit about Medicare? Because, you know, I sell individual, I sell group, I sell Medicare. Now, Medicare is interesting. It's just something about Medicare that people think everything's covered on Medicare, but it's not, especially, and seniors make up the big amount that are expats, right? And they go abroad and they go abroad and they think their Medicare is going to cover them or whatever. And I mean, it's only going to give, depending on the policy, it's only going to give a portion, and that's usually reimbursement. Can you talk a little bit about that?
Yeah, so whenever a client purchases a policy from us, in regards to Medicare supplement plans, okay? First off, Medicare Parts A and B actually stop at the border. They just stop at the border. There's no coverage outside of the U.S. Supplement plans will only cover the $50,000 lifetime max, but that's going to be for emergency medical only. So if you look at some of the benefits on the travel medical insurance as well as the travel insurance policies, you'll actually see that a lot of those policies, there are benefits that are there that are not covered underneath domestic health care or Medicare related, which we've gone over when we've had our calls. So that's really the highlights that I would really pitch with the clients. Well, I shouldn't say pitch, but share with your clients about the need for having it, because their domestic health care plan, their Medicare plan, their employer group plan won't cover for those benefits.
Well, even Marketplace, it's county specific and state specific. So it will cover for emergency out of the state, but if you wanted to go to a regular doctor, it's not going to cover. Urgent care, it's not going to cover. It's just so interesting how that works. But so I want to talk about the various plans, because if for the audience out there, how to access, you could do an easy quote on my website. You go to Robin Harris Advisors.com, Global Medical, and then you could choose the type of plan that you want. You could go easily in there and do it. The quote is a minute. It takes a minute to do. You have facilities, 800,000 providers all over the world, and I want to touch on briefly the student scholar, student scholar plan, and the different plans. Okay.
Yeah. So for students and scholars on your website, it's under students and scholars. So these plans really aren't going to be designed for like the band going overseas for an international concert or competition. These plans aren't going to be designed for clients that are or students that are going abroad for a cultural experience. These are really going to be plans designed for your visiting scholars. So I think you said that you're near ASU, is that correct?
Right.
That's right. Okay. So ASU, I know that they probably have a pretty robust foreign exchange student program, being students are coming into the U.S. For educational purposes. You, me, all of us, for the most part, we're all residents, we're all citizens, right? Again, the law specifically states we have to have some kind of domestic health care plan, whether through our employer or through the marketplace, ACA, some people call it Obamacare, okay? Anyone that comes to this country, if they're here on like work visas, they're also mandated by those same laws. Minus your tourists, okay? Minus your tourists, there's one other group that are exempt from ACA laws, and those are visiting scholars. So visiting scholars are typically going to be here on A, F, J, or M visas. So again, if you ever get a call and they say, hey, I'm a J visa holder or I'm an F visa holder, like F1 or F2, then you will know automatically, go ahead and go with the Patriot Exchange's Health Plan. So these plans will meet those visa requirements.
And we have 2 more minutes, Cy.
Sure.
And we have the employer and business traveler.
Yep.
And the global citizen we already talked about, and the mission for social good. So briefly, the business traveler and the mission for social good.
Okay, so for business travelers, I really recommend the Patriot Multi-Trip, unless they're going to be establishing themselves abroad, like setting up a satellite operation, and then they're going to need expats stationed overseas to help oversee that operation. You can write them up on that plan. In regards to churches and religious organizations, IMG has been in business almost 30 years. That's actually how we began as a company almost 30 years ago, was by writing coverage for mission-sending organizations.
That's awesome.
Such as churches. And we are, believe it or not, still one of the largest providers of insurance for mission-sending organizations.
Really? That is, now that I did not know.
Something to share with your churches.
Well, this was so informative, Cy. I mean, even though I know about these plans, I mean, I learned. You know, you always learn. You always learn more. And so how, as far as getting in touch or wanting to know more about these plans, you could just go to my website, robinharrisadvisors.com, or you can call our office at 602-663-2810. And I can get you covered no matter what state that you're in. Isn't that true, Cy?
Yes, the only state that has a hang-up would be the state of Florida. So if you are looking at a non-resident life and health license for another state, I would look at Florida.
I am licensed in Florida.
Never mind then. So you're free to write about the world.
I
take that back.
I got it covered.
He's like, I'm licensed in Florida. My bad.
I made sure of that. My mom is there, so I had to make sure of that one.
I know that's right. Awesome.
So, Cy, it's been so good. And, you know, I didn't ask you. I know you have, real quick, you have a beautiful wife. You have 2 daughters and a son. And
yes.
So just, you know, give them my love. I'm so happy that you're on this show today. And
thank you for having me. This has been an amazing experience, to be honest. And probably saw my oldest daughter. She was kind of hearing in over here. Stop it. So
I kind of hope we all get to work more from. I work from home. I think it's been good for people in a lot of ways.
Oh yeah, I love it. I
right?
mean, the commute is amazing. Alone. Kidding me? I mean, the commute from my room to here is just.
That's right.
Like a minute.
That's right. Exactly. It's nice. So, Cy, I want to thank you so much for coming on the show. And maybe in the future, if there's something new to share, would you be interested in coming on the show?
Yeah. Or even, you know, if you want to just do deep dives on different niche markets that you have exhibited prominently on your website, robinharrisadvisors.com.
Thank you.
We can do that too.
Okay.
So,
cool. Yeah. All right. Well, Cy Witherspoon from IMGlobal, I am so happy that you came here. Thank you, Cy.
Thank you.
You have a great day.
I wish you all the same, and thank you so much for having me on. I appreciate it.
All right. Take care. Bye-bye.
All right. Bye-bye now.
That was wonderful.
Going to the ad?
Yeah, let's go into the ad. We'll be right back.
Scooping poop is not on your list of favorite things to do. Well, Rich Dog Pet Waste Cleanup Service is here to clean up after your pet. Rich Dog is recognized as being the industry leader in managing pet waste for homeowner associations, multi-unit apartment complexes, residential communities, and condominium owners. You can wash your hands of the whole cleanup business. Your pet waste is Rich Dog's concern. Your dog's poop, your cat's kitty litter is all cleaned up by Rich Dog Pet Waste Cleanup Service. Our service allows your home and yard to be healthy and clean of pet waste. We can visit your home every week, twice a week, or we can arrange our visits to be a cost-effective solution for you. If you're not completely satisfied with your experience with Rich Dog, you won't have to pay a cent.
I'm Brian Kerr with Rich Dog, and I guarantee it.
Our customers like the fact that Rich Dog offers an odor-neutralizing spray that digests and eliminates the germs and those embarrassing odors left behind from our pets. If we visit your home and you're not there, there's no guessing if we serviced your property. Rich Dog leaves a door hanger behind to keep you informed. We look forward in getting rid of any unsightly pet waste and its odors. It's our pleasure to serve you and your pet. For more details, call us at 1-877-RICH-DOG. That's 1-877-RICH-DOG.
When you want to get the accurate information about the future of health and health insurance, just watch the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. It's an invigorating show where Robin brings you experts in the field of health and health insurance. The audience can view the show and ask questions of her guests in real time. That's the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. What's in your health insurance plan?
Welcome back to the Robin Harris Show, Health and Health Insurance. I really enjoyed that. Now, Cy and I have been working together for some time, and I always learn something. And like he said, you could go to robinharrisadvisors.com and go to the tab Global Medical. And depending on what your situation is, you can quote your global medical, your travel medical right there. And it's really easy. We did the quote right online. Right on the show. And it was that simple. So one of the things when I was going over the loss of job, they talked about the different plans that you can get. And they also mentioned about short-term medical. Now, there are people that say, oh, no, not short-term medical. I'll tell you, this happened to me one time. I sold a short-term medical to someone, or I think I recommended it. And another broker contacted me and was upset and said, how could you sell this? And I thought, or recommend this. And I said, ma'am, you don't know the circumstances of this person and why I recommended it. So the thing is about when you're working with a good broker, your situation is not cookie cutter to them. It's not a one size fits all. There's so many variables. That person, maybe they couldn't afford because maybe they couldn't afford a full-blown major medical plan. Who knows? Or maybe they just wanted it for a period of time. Or maybe they're going through a divorce and they do make a little bit of money, but it's just enough where their marketplace plan would be too expensive and they just need a coverage for a period of time just for emergency for their child. Who knows what the situation is? But short-term medical, I'm going to put it this way. It meets a need in a certain circumstance. All right? And so that's what I'm going to share with you today. I'm going to go over short-term medical. So that way you know about it and you can make an educated decision. Because this is all about being educated and understanding so you can make the right decision. Now, a short-term medical, why would you choose a short-term medical? Well, number one, it's flexible because you don't need an open enrollment period to get on it. Like I can, quote you one today, enroll you, and then it could start tomorrow. And people say, well, it says short term, but the laws have been loosened in most states where you can purchase one. In Arizona, as an example, for up to 3 years. You can purchase a short-term medical with a 3-year term. Oh, yeah. And that is with a really great carrier. If you want to know about that plan, just give me a call. It's really good. So, and some of these plans, they cover even preventative, a portion for preventative care. But there are limitations and there are exclusions. And I'm going to go over that with you right now. So a short-term medical is good for someone, I would say, that is in good health. If you have pre-existing conditions, this is not the plan for you. If you have like diabetes and heart disease or something like that, this is not the plan for you. Now, somebody might say, well, what about a guarantee issue short-term medical? Guarantee issue means that you're guaranteed to have that policy issued. I wouldn't recommend it. Oh, no. And the reason why, say, for instance, I have diabetes and I go on this plan and I say, well, I could just pay cash for my medication. But I go on this guaranteed issue plan and I end up in the hospital for diabetes. Guess what? They're not going to pay for that hospitalization. The only reason why they got that guarantee issue is because when they ask the medical question, do you have this, and that, heart disease and diabetes, on a guaranteed issues, they don't ask that question. But they're still not going to pay the claim. All right, so this is not for everyone. It's mainly for if you want a catastrophic type policy and you're in decent health. All right, so it covers doctor visits, preventive care, sometimes, not all the time. No, let's put it this way. It's not the preventive care you get in like a major medical plan, where you can get your colonoscopy and all this kind of stuff. No, it will pay for a checkup, a doctor checkup once a year, and your labs, you know, your preventative labs, that kind of thing. But if you want a colonoscopy and all that, no, it's not going to pay. So it will cover your doctor visits, some preventive care, emergency room, hospital stay, and it will have some pharmacy benefits. These are not robust pharmacy benefits. But if you end up in the hospital and let's say your gallbladder, you have a gallbladder attack, they have to take your gallbladder out and you're in the hospital bed and they have the IVs and all that, it will pay. All right. So now I'm just, the plan highlights as an example. Now, all of the short-term medicals that I have seen, they all have a PPO network. The networks are very good. And what I like about these plans too is that if you're traveling, as an example, I know someone who has, she travels all over the United States all year long. And this is a great option for her because she's super healthy and she wants something for catastrophic, and it has urgent care and it has telemedicine. So here she's traveling around. So in case she sprains her ankle or something like that, she needs to go to the urgent care. There she goes. She goes to the urgent care. It's PPO network. Fantastic. And then if she wants telemedicine, in the middle of the night, she's getting something, you know, I don't know, sty in her eye or whatever, then she can call telemedicine, speak to a doctor at no extra cost. Okay? Office visits. For office visits, benefits come standard with all short-term medical. Not all short-term medical plans will have a copay for a short-term medical visit or a doctor visit. Many times that visit is subject to co-insurance and deductible. So what happens is you get the contracted rate. So if you're in network, you would get whatever that customary rate is. All right. Urgent care, for the most part, in all of these plans is at a copay, whether it's $50 or $75. I haven't seen it more than $75. Prescription, it's more of generic medication. There are some tier 1 and 2, but they're not robust. Okay, again, these are for healthier people. There's flexible coverage periods. Now, what does that mean? You can have it for 1 month. Say you're in between jobs. You have one job, you're going to another job, and you don't want to pay the high expensive COBRA continuation of coverage, but you want something in the middle, maybe for 2 months, 3 months. Short term is there for you. Then you can do 2x12. What does that mean? That you can lock in, you can make the coverage term for 2 12-month periods. I have one plan, it's good for 3 12-month periods. And then also, this is also for child only. They do have, I do have one carrier, they're a major carrier. They have a child only term. And some people really like these plans because it's very inexpensive and it covers for the big event, like if a child breaks their leg or goes to the hospital for even this COVID-19 thing. You know, it's going to cover for that. I mean, it's not like, it's not pre-existing, right? I mean, I mean, how would I say that? With the COVID-19, this whole COVID-19, the short-term medical is paying for the COVID-19. Because you're not going to say, oh, I had COVID-19 before, and now, well, as time goes on, yeah. But I had COVID-19, and now I have it again. No, it's going to basically pay that claim. All these plans also come with a life association or association membership. It's just by law, they have to have that. And so what that does, it gives you, as it was explained to me years ago, power of being in like a group plan. It just gives you protection. You have patient advocacy, which comes with that, and all these different types of discounts for labs and hearing and dental, and you get a lot of discount. Now, what is covered in the short term as far as medical? Well, there's different levels. Some will give you a $250,000 hospital stay. Some will give you up to $5 million. That's a lot of coverage for short-term medical. To give an example of the cost, now, say for instance, your COBRA is, as in the beginning of the show, the average COBRA for a family is $1,715. Say for instance, you don't want to pay that and your family is super healthy and you want something maybe just as catastrophic. I mean, people buy these for that reason, for just having it as a catastrophic plan. As an example, a family of 4, the parents are in their 50s. Now, remember, in insurance, the older you are, the more expensive the plan. So I did a quote, the parents are in their 50s, their children are teenagers, and this plan is at $505. So you're saving $1,200 a month. $1,200 a month. I mean, that's why sometimes the short-term medical is a good option for families. It's up to the individual and what their risk tolerance is and what they're willing to pay. Okay? Not everybody is the same. So, and I went over the guarantee issue. The one thing about these short terms, I will say, if you are more than 250 pounds for women and more than 300 pounds for men, they're not going to cover you because that weight is risky. All right. That is, actually becoming a health crisis for that person, even though they feel healthy. But those are risky weights, okay? And then I went over the different benefits. So that's short term, and I have different types of short term. So this is how I've developed my business. Is in each category of plan, in each type of option, I have different products in that plan, class of product, okay? Because now you're getting down, you're drilling down to a micro level. Okay, now you're thinking of short term, but which short term? And that is when you work with Robin Harris Advisors, that's what you're getting. You're not calling into a call center and you're only getting that particular product that they sell. All right. All right. So I want to also, let's see how we're doing on time. We're doing really good on time. I just want to briefly go over the fact that this week is National Physical Fitness and Sports Month. I posted this on my website, robinharrisadvisors.com. You go to news and you will see this posted, that each May, the President's Council on Sports, Fitness, and Nutrition encourage Americans to celebrate the National Physical Fitness and Sports Month. And you will see on that posting that there's information for children, because a lot of children are stuck at home right now. And for senior citizens, you will see informational web pages when you go to that site, public service announcements, interactive tools, and the program is called Move Your Way activity. So it's a whole program that health.gov has put together for the citizenry. And if you want to know more about this fantastic program, just go to my website, news tab, and you'll be able to see that. And it has a lot of great resources. You know, we have to stay healthy because the best health insurance is taking care of your health. And I just briefly want to go over some of the plans that I offer in my practice. That would be your group benefits, your individual, your dental, your vision, your critical illness, your cancer, your living benefits. And next week, I am going to be reviewing how to layer your coverage with living benefit. That's one of the plans, and with critical illness. And the reason why, I call it health insurance planning. When you go on my website, you'll see it right there. It says health insurance planning that empowers you. You can actually have a portfolio, like a financial plan. You can set up a very strategic health insurance portfolio, very high end. Okay, and I'm going to be talking about that next week. I also have long and short-term disability, different pharmacy resources, Medicare, telemedicine, and pet insurance. We love our pets. So I am really excited because next week we have a very special guest, and that is Margarita Venegas. Margarita Venegas. She is the director and president of Body Therapy and Hair Spa. Now, I love Margarita. She's a personal friend of mine, and she has helped me quite a bit. She is a natural therapist. She does massage. She's been doing that for 35 years. She has been trained in Asia and in Central America. She has been trained, and she is going to be talking about colonic hydrotherapy. Can you believe this? She's going to be talking about that. The mind-gut connection, the gut being the second brain, and how maintaining a colon hydrotherapy. Many people have wondered about this therapy, especially now that the gut-brain connection. She is going to talk about how getting these therapies can change your thoughts. Can you imagine that? She is given, she's referred patients from all of the major holistic clinics in the Scottsdale and Phoenix area. I mean, the big names. They send their patients to her. She's phenomenal. Well, she's going to be right here next Thursday, 10 a.m. Arizona time. I am so excited she's going to be here. For a free health insurance consultation, you can go to my website, robinharrisadvisors.com, and put in a request. And then if you could always call the office at 602-663-2810, and we will be so happy to answer your questions. Now, I want to also thank my producer, James Dunson, and our tech guru, Scott Antrim. A lot goes on behind the scenes, and they get it done. It's pretty phenomenal what they do. I just want to make sure I'm getting everything over to you. So, oh yes, if you want to be a special guest on this radio podcast, you can go to my website to radio podcast, robinharrisadvisors.com, radio podcast, scroll down, and you can make a request to be a special guest. That has to be in the fields of health or health insurance, and I would love to have you. Just put that request in. And lastly, I just want to say, the best health insurance is taking care of your health. Because health insurance is only one tool to pay for health care. But we want to live long lives, and we want to live healthy lives. So that's why we want to do everything in our power to take care of these bodies and keep them healthy. So that best health insurance is taking care of your health. Thank you so much for being here today. I really appreciate it. I look forward for you to tune in next week. This is the Robin Harris Show, Health and Health Insurance. Make it a great day. Goodbye.
Studio8181.com is a talent development and management company that owns its recording studio and video production center located in Peoria, Arizona. Share your media content, earn income, and talk to your fans all from one spot. Studio8181.com positions your content to be seen by important decision makers so you can attend exclusive auditions and or get invited to perform at venues many entertainers only dream about. The producers and engineers are determined to create new opportunities for talents, aspirants, and future stars. Don't have the money to do a soundtrack or a promotional demo video? Not a problem. You can simply request and schedule an audition. If you have the talent, we want to hear from you. Get your entertainment website and more. Email us at info@studio8181.com. Thank you.